Maybe I can share.
Excellent.
Yeah, okay.
All right, so it's about 3:01 EST. And so again, I'm Kraken or Candace. I'm known as Kraken on the server. And so I'm here to introduce to you Dr. Meng-Han Tsai. I also know her as Mina. She is an assistant professor for the Department of Health and Human Services and Public Policy at California State University, Monterey Bay. And she does really cool research in public health relating to like how health is affected by race and how we can use public health and data to screen for cancer prevention and control, and how there are differences in access to care and healthcare. And so she will be presenting her talk on public health research and action. And so welcome, Dr. Tsai, to BioRecord. And we're very excited to hear you talk. Also to our attendees, if you could remember to put your questions in the Q&A function, that would be really great. And Dr. Tsai, I will let you start.
Okay, so hello everyone. So thanks for having me here. So today I want to focus on the public health research in action. So I will use my current project to be the example to present like usually how do we collect the information to help you to answer like the topic like our research questions, and how did you there are so many ways you can do the data collection, and then I will show you like how do we do the data collections process and why we use those methods to do the collection. And so right now I just want to brief to introduce my study. So my studies is focused on the Latinos populations because I'm located in California. So this is my majority populations in the California. And I focus on the cancer screening prevention and also the follow-up. And we want to try to understand what kind of the factors may link what help us to explain what kind of the factors may explain their lack of the cancer screening use. Because most of us, we know like the cancer can be prevented as early as you can, just but you have to do it like regularly for the cancer screening. So before we go to the topics, I just want to do a very quick small game. So I hope everybody can see here. If you never played the Kahoot game, just go join to search on your Google or any browser, just type the Kahoot in, and then you will enter this ping. I prepared just the 4 questions to help us to get started. If you don't know the answer, that is totally fine. Yeah. I'm not sure how many people in here, so I guess we will wait for a little bit for everybody to join the game. Okay, so I guess we can go ahead to start. No pressure, so if you don't know the answer, just try to guess. Because I will explain during my presentation. And also watch the time limits. Yep, actually it should be all, the house actually reflecting where you live, where you shop, where you sleep, everything. So I will talk more details later. So just keep in mind these questions. So let's go to the next one. Even you don't know this definition, is totally fine. Just try to guess. Yeah. Okay. Yeah. Social determinants help include everything. So I will explain more detail later again. Yeah. So let's try the next one. Okay, pretty good. Everybody got it right. Yeah, our social economic status definitely will impact our health. So I think this is the last questions we have. Yeah, actually, community health promotion is kind of very important, and that is also my current studies. We focus on this. So I will use my study to show you like how do we do. So why the community health promotion would sometimes we can say community health education is very important, and especially what you will involve some of the culturally factors in there. So let's see who are on the podium. Okay, so I hope you have a little bit fun for this little game. Yeah, I just want to do this little game to help you to get started for this topic. So right now we will back to my presentation. Before I talk about my study, and I just want to introduce my team. So this project, the abbreviation we just call CELCUS study. So in our team, Dr. Cabral is the principal's investigator, and she's also one of my colleagues from my department, so which is the Cal State University Monterey Bay. So I'm the co-investigator under this project, and we also have the other two. One is the nurse and also our community's partners, because this is the community-based study. And I just want to briefly introduce my research interests, so it can give you some idea like why I really focus on this topic and focus on this population. So most of my research interests were around the racial disparity, so especially focus on cancer screening, prevention, and control. I really interested in like what kind of the factors may address the people's behavior. So this is more like health promotion, health behavior part. So that's also very important under the public health. And I also have some experience to talk about some like access to care or healthcare utilization. So overall, I would say my main research focus is on the cancer screening, prevention, and control among the minority or underserved population. So before we start to talk about my CELCUS study, just take a look at these three photos. So, and then you try to think, do we really choose our house, and what did you think from these three figures? So let's start from the first one. So the first one, we say equality. So as you can see from this figure, we give everybody, these three people, these three persons, we give them the exactly same resources or same things, for example, for their health care. But the thing is, not everybody can see the game. But when we talk about the equity, which means we want to see who need what and give them maybe extra resources to help them can see the game. So when you apply to the healthcare systems or access to care, so which means we give what the people they really need to help them to improve their health outcome or get access to any kind of the health service. However, in the realities, it's very inequity. So that is one of the reasons why we want to really talk about this topic. So when we talk about this topic, there are some definitions I feel is very important to explain at the beginning, so you can have a more clear idea. So those concepts also link with the Kahoot game we just did earlier. So a lot of time when we want to discuss what kind of the factors may impact your health outcome, we can call it health determinants. So health determinants are actually they include so many categories. So for example, the first things we can consider the biologies or genes. So for example, your gender or your age, those kind of the things. And the second one, we can consider the health behavior. So the health behavior can include like, did you do exercise regularly? How did you usually prepare your food? What is your eating habit? And did you have any alcohol use or any drug use or any smoking behavior like tobacco use? Those are linked to your health behavior. And the other factors under the health determinants we can consider is called medical care, or you can say health service. So those we most talk about like the access to care, like especially on the good quality of care, and does the people have for insurance? Because in the United States, I think we all know, like, if you did not have a health insurance, you are so difficult to get access to any kind of the health care. And the next one, we will talk about the physical environment. So physical environment is more linked to where you live, where you work. Did you live in a very crowded area, or you live in a rural area? Those may also link with your health condition. So this is also under the health determinants. And the last one, we talk about like social characteristics. So this has become more important lately, and especially a lot of studies start to talk about more, because we know some of the community, they have some discriminations issues come up. So especially involve some of the culture's components. So those kind of the things may also link with our health outcome. So as you can see from this figure, health determinants include so many different components, and actually each factors interact with each other. So your health conditions may not just come from one factors. It can be maybe several factors that interact with each other, and then you see this health outcome. And a lot of times when we talk about the health determinants, and then we will talk about like the social determinants of health. Actually, their definitions kind of similar, but the social determinants of health is been common to use and also in a lot of research study. So let's look at these figures. So in general, we can see like social economic factors is about 40% were linked to your health condition. So what are the social economic factors, like your education, your job, and did you have any family with social support, your income, and your community safety? Those may consider the social economic factor. And the physical environment, just about 10%. And our health behavior is about 30%, also play a major role. And the last part is 20% is our health care. So did you have access to care, and did you have access to good quality of care? So in general, we will say about 80% will come from like physical environment, social determinants, and also your behavioral factors. They may contribute to our health outcome. So only 20% is more linked to the access to care and do we have a good quality of service. It's more like the medical resources. So here just like more breakdown, more detail to show you like, okay, if we talk about social determinants of health, there are so many factors may link to any kind of the health outcome. So when we say health outcomes, it's not limited to any particular disease. Sometimes it could be like your life expectancies, or how did you spend on your health care, and also your, in general, your health situation. So we are not just focused on individuals' health, definitely is your community health, because social determinants of health include the place you live. So definitely we consider whole community. That is also the goal for the public health. We more focus on the population's health, not really the individual's health. And because we talk about social determinants of health, so why this is so important. So as you can see from the beginning, the photo I show you, like we try to understand what kind of the factors may cause like maybe some limitations to access to care or use any kind of the healthcare service. So that's why addressing the social determinants of health can help us to achieve the health equity. So at the beginning, it's very important. We always need to understand what this community, what this population, what they need, and then we give them what they want. So that's always very important. So if today you study the different population, it's always good to understand their demographic first, to understand what kind of the determinants from this population, and then to give them the appropriate resources to help them to get more access. So here are just some of the definitions for the health equity. So I may not read through that. So just like, as I mentioned earlier. So that's why address the social determinants of health, we just try to remove the health inequity. Because as we can see, the poverty or unequal access to care or your education's level, those kind of the things contributes to your health inequity. So right now, let's start to talk about my study. Because my study is circled around the social determinants of health, so that's why I want to present the definitions first and also show you why these factors discuss these factors is kind of very important. So for the CELCUS studies, because we focus more on the cancers prevention and screening prevention, so I want to more focus on the cancer, right? I'll start from now. So let's take a look like what is the cancer and can be prevented. So I think everybody is very familiar with the cancer. So what kind of the factors can cause the cancer? They're also very complicated, include like external factor and also internal factor. So internal factor is more like your gene or your hormone, your immune. But external factors is more related to social determinants of health, what we have mentioned, like the tobacco use, or your diet, your exercise. So all those factors when they interact with each other, they may link to the cancer's cases. However, we find like about 42% cancer cases and also 45% cancer that actually in the United States can be prevented. So once you do the regular screening, you do the regular checkup and follow the doctor's instructions, like if you find something at your screening and the doctor suggests you, maybe after a few months, you have to come back. So just make sure you have to follow this. So all the cancer cases and the deaths can be prevented. And right now I will talk about my studies populations because my studies more focus on the Hispanics, Latinos population. And why we want to focus on this population, one of the reasons is my locations in California. So Hispanic Latino is the largest and also the young minority group, and also they are growing very fast. So as you can see from this right map, you can see most of the Hispanic and Latino population is located in the West Coast and some of them in the South. So that's one of the reasons my studies will focus on this population. And how about the cancers incidence and mortality rates we find from the Latinos population? So we find in 2018, like if we separate men and the woman, there are 67,000 new cases can be found in the woman, but the 81,000 cases can be found in, the previous one is for the men, and 81,000 is for the woman, can be diagnosed as the cancer. But how about the mortality? We can say the death. So for the men is about 22,000 and the woman is 20,000. So here, just give you a little bit background information. It's always important to understand your populations first. And as you can see from these two figures, we want to break down like what type of the cancer is the major concern by the gender. So when we look at the new cases, sometimes we can say incidence rates. Under the male, the top one is the prostate cancer. For the female is the breast cancer. But when we look at the deaths, like the mortality rates, the top one is lung cancer, but the prostates become number 4. And the female still the same. The breast cancer is the top one. So which means this data can give us some of the idea like what type of the cancer, and based on the different gender like male and female, how can we help the different population? So this data is also focused on the Latinos population. So once you have a clear idea about like some of the background information about the cancer among this population, so right now I will start to talk about why our study is important and why we want to do this. And because when we do some literature review, we find like the utilization of cancer screening among the Latinos population usually not a lot of those evidence to show. However, we find some of the study, they more focus on the non-Hispanics, while they point out some like social, cultural, or economic factors may help us to explain the utilization of cancer screening. So that's why we want to try to understand, okay, so if today we did not focus on the non-Hispanics, why we focus on this Latinos population, what kind of the factors may address their lack of cancer screening? And actually a lot of them, when even they are using the cancer screening, when they diagnose it, a lot of times already at the very late stage. So that's why we also want to see, okay, what kind of the factors may also link with their cancer's outcome. So here is our study purpose and the research questions for our study. So as I mentioned earlier, so that's why our study purpose is we want to identify and describe any potential factors in the Latino men and women. And also we'll try to understand like the healthcare system is any kind of the relative factor may also address like lack of the cancer screening use in this area. So our research questions could become like, okay, what kind of the factor, especially in the culture and the social environment. So those you also can link to the social determinants of health. So among Latino men and women, and also in the healthcare delivery systems to help us to explain the cancer screening use among this population. So right now we will go to the methodology. This study, I would say, is more like pilot study because not a lot of article, they study this population. So that's why we have to start from the beginning and we try to collect more detailed information to help us to build a larger study later. So this is like the pilot study, and then we recruit the Latino in Monterey County in California. So those people, they receive the primary care in one of the local community center. So our data collect we recruit the patients from the January 2014 to 2019. So for our study sample, like Latino men and the woman, we classify by the age also. So for the men, we recruit them like age 50 years or older because we base on the cancer screening recommendation. But for the woman, we separate the oldest woman and also the youngest woman. And the reason is in our study, we want to discuss the cervical cancer screening use. So that's why we separate the older and the younger woman, because for the cervical cancer screening, their recommendation is should be earlier. So how do we recruit our participants? At the beginning, we send out the mail, like the letter, and then to the participant, and then we give them the postcard so they can mail it back. But a lot of time they don't do it. So ends up if we wait for like 7 to 40 days, and then we did not hear back from our potential participants, and we will start to make the phone call to ask if they're willing to participate in our study. And because our populations are most of Latino and Hispanic population, so in our projects also have bilinguals, undergrad research assistant, they will definitely use the Spanish to recruit our participants. So once we use the phone call and then to schedule appointment, and then we will start to do the data collection. So for the data collections process, what the measures we want to collect, we include like their social demographic factor, and also some of the clinical indicators, because we also want to understand, do they have any like family history? And also some factor related to healthcare utilization and their health belief and their behavior. Those informations we will collect during the process. So this study we use the mixed methodology. So we use the qualitative research methods and also the quantitative research methods. So focus group is the qualitative research methods. Because focus group is like, you may not easy to get a large sample size, but you can schedule, maybe arrange 5 to 6 people in one group, and then you have all the open-end questions everybody can discuss. So it's more like conversation. So you can easy to collect more detailed information. So again, because our population, so our research assistants also involved in this process, then all the process, they will use the Spanish, and then we record it. So at the end, we translate all the transcript from the Spanish to English for analysis. But right now, because our studies is still at a very early stage, so we focus on to complete the focus group first to get more detailed information. But for the survey interview, we just start to use to collect 1 or 2. So the survey interview, we build them in the tablet, but we still schedule the time with our potential participants, and then we do it like face-to-face. And our students also use the Spanish to ask them. So actually they did not complete the survey by themselves. It's more like, we ask them questions, but they give us the answer. So the survey interview most of the questions are more like closed-end questions, like multiple choice. So it's a little bit different with focus group. So that's why we want to do these 2 different ways, because focus group is more like qualitative research methods. It can give us more detailed information. We want to understand what kind of the factor. And during that process, maybe we can ask the questions that if we want more detail. But for the survey interview, a lot of time is more like, because you give your participants the option, so you are so difficult to know like the reasons or the detailed information. So that's why we want to use these 2 different techniques to help us to collect more information, to help us to develop more clear idea about what kind of the key factors may address their cancer screening use. So for our study, we just focus on 3 cancers. So one is the prostate cancer. This is more for men. And for the woman, we include the breast cancer screening and also cervical cancer screening. So that's why under our sample, the woman, we recruit the older woman and also the younger woman. And for the analysis, because as I mentioned earlier, for the survey interview, we just start to do field collection. So that's why we did not reach the data analysis process. So I will more focus on like, okay, how do we, once we get the focus group transcript, how do we really analyze these qualitative data? So a lot of time you have to pick up the series you want to use, any kind of the model. So in our team, we decided to use this model. So this model include the 3 different factors. So one we call predisposing factor. So which means is any kind of the social demographic factor may contribute to the person, their motivation to act. But for the enabling factor is like what kind of the skill or resources maybe will help them to complete their health behavior. And the reinforcing factor is more like, okay, what kind of the resources or factor you will use to help you to continue this health behavior. So we mainly use these models to help us to analyze our focus group transcript. And then we definitely, everybody may not get at the same page, but so we always need to discuss and try to finalize. So here is our preliminary findings from our focus group transcript. So based on current situation, and then we complete the 7 focus group. So all the participants, their average age is about 52 years old. So the range is in between 29 to 63. But right now, most of our participants are female, and most of them are Mexican origin. So according to the model we use, so we find the predictors, like for example, the first one, the predisposing factor, including like lack of income to see the doctor, they did not have insurance. And also we find most of them, the lack of their knowledge about cancer prevention and also the risk. And because in their family, a lot of times they don't really talk about this. So they totally no knowledge about how to do the cancer prevention. And also, so that's why those kind of the factor we classify under the predisposing factors. So for the enabling factor, we find like some of the participants, if they get sick, they will start to use like healthy food way. They try to use what they know and then some of the resources that they know to help them to get them have the healthy life. And some of the participants, they tell us like, oh, they try to be positive all the time about their life because that also help their physical condition. And some of the women that attend the woman, infant, and the child classes. These classes is very, I would say it's kind of common in a lot of different places, especially in the community. So this is more target for the low income woman. And I think their class teach so many things, but more focused on like, how did you eat healthy? How did you prepare your food? And then to help you to have a healthy lifestyle. So sometimes when they attend these classes, they also can get some information and learn something from there. And the last one, reinforcing factor, we find the religion play a very important role. And also sometimes if they get sick, they will start to use home remedies in their home. And also they will use a lot like their family support to help them to have a better lifestyle. So those are the preliminary findings from my study. So because my study still continue, so yeah, it's a lot of work, but this is our final goal. We hope once we've done the data collection, those information can help us to develop more culture sensitives and also to bring those information to build the cancer educations interventions in the community. So we hope we can build the care delivery model in this population because we try to improve their cancer screening utilization and definitely their follow-up. So this is as I mentioned earlier, this is just like pilot study. So we hope those information can help us to develop the larger study. And then we want to identify more factors and then to try to help us to build more strong intervention to improve their cancer screening use for early cancer detection, prevention, and definitely control among this population. So thank you for listening. Hope you feel some informations are useful. So feel free to let me know if you have any questions, or either you can email me. Yeah, I'm happy to talk.
Thank you so much, Mina, for being here with us today and giving us this really awesome talk. We do have a couple of questions from the audience.
Okay.
So how do you decide how impactful a health determinant is?
It's more like, how do we decide what kind of the factor we want to collect?
Like, how strongly does a health determinant affect somebody's health?
I would say it's a little bit difficult, especially for my study. Right now, it's more like early stage. So we try to collect more detailed information to figure out what kind of the factor. But if you want to identify, like, for example, you want to maybe to select the top 3, you probably need to build more larger study and then to do more data collection. The sample size play a major role. So you can more easy to see, okay, use more quantitative way to show people like, okay, what kind of the factors maybe play more important role on their behavior. Yeah.
Okay, and so what is like the biggest struggle you have when recruiting participants for the study?
Oh, that is a really good question. Yeah, we have a lot of challenges. So sometimes we have to delay our data collections process because, as I mentioned before, we always send out them later, but a lot of time we don't really get anything back. So that's why we have to start to call them one by one. And depends on their working schedule. Most of them are farm worker, like, so that's why their schedule is kind of like weird. We also try to learn better from this population. And the big challenges we find is even the schedule with us to do the focus group. For example, a lot of time we try to do like either weekend, and then we meet them in the healthcare center, so they don't have to commute for a long distance. But sometimes they don't really show up. So that's why we lose a lot of our participants. And when we try to discuss with our community's partners, they say yes, because their schedule sometimes could be, because their working schedule is more like part-time. So if today their company or employer asks them, okay, today there are 2 or 3 hours, you have to back to work, maybe. So definitely they cannot show up. Yeah. So that is our big challenges so far, but we still try to learn better how to help us to do the data collection.
All right, and so how do you begin to collect these participants, and like how much does the participant pool drop from the first to the next step?
Okay, so from our study periods, we recruit the participants if they use primary care service in that local community center. So we start from the January 2014 to December 2019. And then I remember total when we pull out our all the participants, it may be around 4,000 participants. But we do the random selections by the gender, like male and female, because our goal is we want to reach at least 120 sample. Yeah, but right now we only have a very, very few, but it's kind of reasonable for the qualitative research. Usually you just can get a very small sample size to do the focus group. Yeah.
Okay. How strongly does lack of support or education or insurance put on getting screened and having proper health care?
Yeah, I would say these two play a major role because, for example, like the insurance, if you did not have a full-time job, a lot of time you are unable to get the good health insurance. So definitely it will impact you to use any kind of the healthcare service. And people always nervous to spend tons of money, especially in the United States. The healthcare service is very expensive. And the other thing is most of our participants, they are undocumented immigrants. So they're also nervous like, okay, if they get the insurance, so which means their information will show up in the government's level. So that's also another reason they just try to survive under that situation. So that's why community educational programs, it can help them to release a little bit stress to get more access to healthcare, because most of the education program from the community are free for use. Yeah.
Okay. I have another question. So how did you decide to get started with like public health? Like how did you go into this field?
That is a very big question. Yeah, to be honest, it took a long time to figure out what I really want to do. I have to say, when I got my bachelor and the master's, also include my doctor's degrees, are all focused on health administration or management. But just once I start my doctoral program, I realized to study a lot of the health policy and the management is not really my interest. I'm really curious about like the people's behavior and how to help, especially for some minority population or underserved population, how to help them to get the access to the right care and the resources they want. So that's why when I was a doctoral student and I worked with one of my the faculty from my previous school, and then her study is more focused on to identify those kind of the factors. So that's why even I did not change my major, but just my research just switched to that direction. So I did not focus a lot on the health management or health policy. Even we talk about the policy, probably just like the health insurance. Yeah, as we know in the United States, the health insurance impact a lot for the healthcare access. Yeah, so that's why I end up here.
All right. And so kind of a related question towards like education. Does the educational level of parents affect the healthcare facilities available to their children?
Yes, sometimes, as I know, sometimes, yeah.
Okay. I think that is it for the questions that we have right now. Do you have anything else that you want to say to our audience?
I just want to quick share like a lot of time when we're thinking about the public health, you probably was thinking, oh, it's not my business. But the thing is, I have to say, public health is related to the population's health and also all around the place we live, we work. So that's why everybody play a very important role to help each other. So that's the things I want to mention. Yeah.
All right. Well, thank you so much for doing this with us. And thank you to our audience for being here today. We have our keynote speaker, Dr. Randy Sheckman, in about 15 minutes. And so if you already signed up, you should already have the link for that. And thank you again so much, Mina, for doing this. This was a great pleasure. And have a wonderful afternoon.
Thank you.
All right. Thank
Bye-bye.
you.